Okay, the next part of the patient care would be for them to be examined, and we have 2 exam rooms. And in the rooms, we first have the patient watch a video on chiropractic, and the video is usually about 9 minutes and explains what chiropractic is all about, as well as what they'll be undergoing here. After the video, then we then go in and do their exams and determine what areas we need to x-ray. And from there, we'll go into x-ray and shoot their x-rays. And let me show you where the x-ray room is. Okay?
All right.
Come with me. If you would, you can step in here.
Thank you.
And as you can see, this is the x-ray unit that we use. It's a new unit, and with this unit, it will pretty much take care of any x-rays that we need. We do full spine, we do extremities, everything. There are cases at times where we may have to send someone out that's really large to the hospital, but for the most part, this is up-to-date, most up-to-date type equipment that we use in x-raying the patients.
Okay, great. Let's
go into the next room, which is where we go over the x-rays with the patients and determine what kind of treatment we're going to render. Okay?
Mm-hmm.
Now, generally in here, what we do is we go over the patient's x-rays with them, and we also already have the findings from their orthopedic neurological chiropractic exam that we had done, and we determine at this time what kind of treatment they need as well as their diagnosis.
Most of all, after 8 years of having pain with my sciatic disorder, it's almost pain-free now. And it's
one of the treatments that we use is the ultrasound, which you can see Sandy performing here. The ultrasound are used to relax the muscles, relieve pain, and help with a lot of the muscle spasm that goes on. Okay, let's go next door.
So is this sometimes effective in place of drugs?
Yeah, so a lot of times we'll use modalities, physiotherapy modalities to relieve pain and discomfort, which a lot of times the medical profession will prescribe drugs for it. And this is more isolated to one area, and it's not something that's going to be systemic like a drug would be that would go throughout your whole body. And we're going to take a look at someone getting decompressive traction decompressive traction. And this particular table is used for people with disc problems or people with pinched nerves, okay? Mm-hmm. Generally, this table can be used for either disc problems in the low back or in the neck area, okay? Mm-hmm. Now, people with sciatica, which a lot of people know what that is, people having pain in their back and down their leg, the decompressive effect of this table helps suck the disc in to relieve pressure on the nerve.
I can see the table is beginning to come apart and move right now.
Exactly. The table separates in the middle here, and that's what creates the traction, and it decompresses the lower back area, okay?
Go bowling, and I threw my back out after about 4 bowling, trying to throw the ball about 4 times. And from then on, I started limping real bad. And I thought, oh no, I don't know what I've done. I was kind of scared. And I'll tell you, with a few times I'd gone, I could see a big improvement. And today, I feel like I've never had a problem.
And the one thing about adjusting the spine is it's an art. Mm-hmm. And there's a lot of different adjusting techniques that are employed by different doctors. But we try to use this particular table because it's probably one of the Cadillacs of the adjusting tables that's out there. Mm-hmm. And this table has a lot of drop mechanisms. It has flexion distraction, which we can treat disc problems with as well. So I'm going to make a correction on his pelvic and sacrum area. And then just a hair, Mike. Thank you. As you can see, this table has drop mechanisms that make it a lot easier on the patient and on the doctor as well. Good. Very good. That looks good. Let me check your leg length again. Relax your feet. That's even. That's even. That did it. I have completed adjusting his spine, and his neck's okay, so I'm not going to be messing with it today. Mm-hmm. But as you can see, adjusting is really, and some is not that difficult to do with patients. And as you can see, a lot of people have a fear of being adjusted, thinking it's going to hurt. And as you can tell, it didn't seem to be creating any pain for Mike.
If you're one of the many people constantly feeling sick or not your best or dealing with persistent pain, help is out there.